Hello, everyone, and thank you so much for joining us today at this statewide virtual town hall about Colorado's new family and medical leave insurance program. I'm Tracy Marshall. I serve as the Division Director of our new Family and Medical Leave Insurance Division here at the Colorado Department of Labor and Employment. David Gallivan is our Family Compliance and Appeals Branch Manager. He and I today will be going over the major points of how family leave is going to work for both employers and employees. Then we'll be answering some common questions, and we'll be certainly adding time at the end to answer any questions that you still have. Some quick housekeeping. Our streaming viewers are welcome to type out any questions on your dashboard, and we'll get to as many questions as we can in the hour that we have together today. If you'd like to dial in and ask us your questions live, please call 833-305-1729 and then press *3. You'll be placed into the queue, and then we'll get to your question as soon as we can. If you're already listening by phone, just dial *3 to get into the queue so that you can ask a question. Again, we'll try to get to as many questions as we can today. We will be sending out a recording of this session along with the slide deck to everyone who registered shortly following the town hall. Both will also be published on our website, which is at family.colorado.gov. So our agenda for our time together today, we will be going over the basics of what family is. We'll be talking about our upcoming deadlines and the My Family Plus employer system. We'll take a look at our timeline and give you some updates on private plan options. We'll also talk about the tools we have available for TPAs and give some updates for our healthcare provider communities. David will also provide some notes on an upcoming public hearing for more rulemaking. So with that said, let's get started. So a quick recap of the program itself. FAMLI will provide paid leave for Colorado workers to take care of themselves and their loved ones during certain life events, such as welcoming a new child or to take care of a loved one to help them get through a serious health condition. The program will cover almost all workers in Colorado, including those who are self-employed. The FAMLI program is a social insurance program with both employers and employees contributing to the fund that will eventually pay out benefits. The premiums are set to 0.9% of the employee's wage, with 0.45% generally paid by the employer, and the other half, that other 0.45%, paid by the employee. The initial family premium rate is fixed at that 0.9% through the end of 2024. For 2025 and beyond, the statute states the director of the family division can set the premium rate according to a formula which is based on the monetary value of the fund each year. Family premiums are capped per the statute at 1.2%. It has been demonstrated in several states that premiums have decreased and benefits have been able to increase over time. So by now, you've probably heard that it's time for all employers to meet their obligations under Colorado's new law, setting up a family and medical leave insurance FAMLI program. Employers with even a single Colorado employee need to register and submit wage reports and premiums for Q1 of 2023 by April 30th. That's just 3 days from now or this coming Sunday. Businesses with 9 or fewer employees do not owe the employer share of the premium. They are still required, however, to register, submit employee wage data, and send in the employee share of the premium. Now, for this first quarter only, the FAMLI division has extended a grace period until May 31st to help our Colorado employers adapt to the new system. But we do suggest that you don't wait. Call us if you need any individualized assistance to get this done, and we'll go over how to get in touch for that individual assistance here in just a moment. So again, we are just days away from the first deadline that you can see on our timeline here. While we are offering that 30-day grace period before any payments are considered late for this first quarter of the program, employers do need to remember that the typical reporting schedule is the last day of the month following the end of each quarter. So the dates to remember for future years are April 30th, July 31st, October 31st, and January 31st. If an employer fails to submit wage reports and premium payments, the employer may face a fine of up to $50 per employee whose wages are not reported, plus any late fees and interest. All businesses with employees in Colorado must register in order to submit your wage data and pay your premiums. You'll do that online via the My Family Plus employer system, which is our employer services portal. Just go to family.colorado.gov and click on the Login to My Family Plus employer button. We have step-by-step user guides and how-to videos on our website to help you get through the process. So we recommend you get it done today and make sure you avoid those penalties. I'm going to hand you over now to David to talk about some private plans.
All right, thank you, Tracy. So we do have now a list of private insurance companies that have submitted family plan policies to the Division of Insurance. We're working very closely with our friends over at the Division of Insurance on getting those policies approved. It's their job to approve those, and then we will post them up on our website into a marketplace for employers who are deciding to go that route to use and to shop for. So again, just to back up a little bit, in the family system, you can participate in the state system, and that's really what we're talking about here today. We have the employer portal. We collect premiums, we pay benefits. But there is another option out there to go through and to get a plan from a private insurance company. And those are now being listed on our website, and we should very soon have some of those carriers available for people to go out and purchase directly from those carriers. Now, those carriers do have to file their policies with the Division of Insurance and get approval before they're added into our system for a formal application. And if you select one of those policies, you then have to have the specific policy approved. So you'll submit that through our portal, we'll review it and look at it, and we can approve that. And once we do that, then you'll be covered underneath that private plan. Now, inclusion on this list on our website does not mean that you're automatically going to be approved. We're still going to review the specific policy they've issued to you as an employer, and then we're going to make the final approval. You also, very important here, you have to let your employees know no later than 30 days before the effective date of the private plan. So you can't just wake up today and say, you know what, we're going to switch to a private plan and we're going to do that today. You do have to give your employees 30 days notice of that. So if you're thinking about doing that, keep that in mind. Make sure you're telling everybody what you're doing, you're shopping for those plans, and you're coming to us once you select one so that we can give you final approval. We do have detailed guidance on this on our webpage for private plans. It's under the Employers tab, and that's also where you'll eventually find the private plan marketplace that will have the list of all of those carriers. I know out there we do have some third-party administrators who are joining us today, and I think we've got a few more people who are just asking us questions about their third-party administrators. But for the TPAs, we want to remind you to include your client's business email address in your bulk registration file. So if you're a TPA and you are uploading all of your clients at once, make sure to give us the business email. Now, that's not going to break the system or stop the upload if you don't have it, but it is really important. That lets us notify that business that they have been registered. It allows them to connect their own account with that registration so that they can make changes if they need to. And it also lets us know how to contact that employer, because we may have specific issues that we need to discuss with that employer that aren't necessarily going to go through the TPA or that you may not want to be mediating. So if you don't have an email address, leave it blank. Please do not put fake email addresses in there. Please don't put your email address in there. We want to know when we're sending an email out that it is going to that business. And so if we don't have the email address, we won't send an email. We'll find another way to communicate. I've been around long enough. I remember using the passenger pigeons, fax machines. We'll find some way to do it without that email address. So please leave that blank if you don't have one, but also please try to get one. It's going to make making the system run in the next couple of years much easier for all of us if we're able to communicate directly with the employer, and if that employer is able to log into our system to do some of the tasks that they may want to do without running that through you. All the file specifications and sample files that you're going to need to register, report, and pay on behalf of your clients are available on the TPA page. That's linked on this slide. You can also find it readily available just from the main family homepage. We also want to talk about some new resources we're about to launch for healthcare providers. Now, this is really exciting. We are leading the way on healthcare provider services. The family benefits application system that we're building is going to allow healthcare providers to register in the system and make recommendations on leave duration for their patients based on their condition or treatment plan. This is instead of a massive packet of paper. Healthcare providers are going to be able to log into a computer, fill out a form. It's going to come directly into the claim file. It's going to notify us that it's there. Nobody's going to have to carry paper back and forth. Nobody's going to have to make copies or scan anything. We're not going to have to store paper. So this is really exciting to be developing this. Healthcare providers are going to register directly in our system, and it's going to let those providers provide an elevated patient experience when a serious health condition prevents an individual from working. The more providers who use this system means many patients aren't going to have to bring documents into the office during stressful life events. System registration is also going to help protect your credentials and ensures that we're only getting certifications from approved and licensed healthcare providers that are making treatment decisions based on their medical knowledge and not somebody who may have, we'll say, misappropriated some of those credentials. That link also in our slide to sign up for the newsletter that's going to be just for those healthcare professionals. It's going to let you know when and where you can register and help you walk through that and keep you up to date on this program. Another update we'd like to share, we got some new proposed rules out for your feedback. The details are all on our website, but to give you an idea, the topics are regulations concerning program integrity. So that's making sure everybody's paying the right amount, everybody's signing up when they're supposed to, claimants are getting the right amount of payments, coordination of benefits, and reimbursement of advanced payments. So that's going to deal with situations where there might be like a short-term disability plan or some workers' comp going on. Investigations, determinations, and appeals on situations kind of related to that program integrity situation where somebody might be misclassified. Job protection, anti-retaliation, and anti-interference. So these are rules that are going to govern the job protection status. So if you have an employee who's out on family, they meet the qualifications, they have enough hours worked, their job is protected, and you have to return them to the same or substantially similar position when their leave ends. And so how that's going to work is part of these rules. So these rules right now are in a proposed state. So you can go to our rules page, you can see the draft that we've proposed, but these aren't final. They don't become final until we have a public hearing. That's going to be May 15th, beginning at 5. It's over Zoom. It is completely remote. You do not have to come downtown. You don't have to find parking. You can log into the Zoom if you want to attend. You can also just send us a written comment. If you have thoughts on how these rules are going to work, put it in a letter. We've got a form for you to upload it. So anybody can attend. We'd love to hear from the people affected by these rules. We're sitting in a dark conference room here in a government building, thinking about how we want the system to operate. And you know, for that, we do a pretty good job, but it only gets us part of the way there. We love hearing from employers, from workers who may be taking leave, from TPAs, from people who are going to be administering these programs about how they think the system should work. So your feedback as part of this rulemaking process before we finalize these rules is critical. I promise you, we read every word, several times, several people read every word. We go through it. We do make changes based on that. It's how we get good rules that are going to make this system successful for everybody involved in the process. So please do take a look at those rules and send us any feedback that you'd like us to have and consider before we make them final. And with that, I'm going to hand it back over to Tracy.
Thank you so much, David. So again, if we don't get to your question today, we do have some more resources you'll want to check out. Make sure that you're subscribed to our newsletter at this link in the slide so that you'll get your monthly updates delivered to your inbox. You can also cater your notification settings to your own preference by signing up for specific updates relevant to employers, third-party administrators, healthcare providers, or individuals and families. So as David said, we do want to hear from you. You can engage with us in a variety of ways in addition to attending these town halls. You can see our email address is listed on your screen. You can also follow us on social media. You'll find us on Facebook, Twitter, Instagram, and LinkedIn. You can also subscribe to our newsletter, as I just mentioned, on family.colorado.gov. And you can also reach out to us via phone at 1-866-CO-FAMLI. And our phone lines are open and staffed Monday through Friday from 8 a.m. until 4 p.m. So let's get to your questions. Just a reminder, if you'd like to dial in, as several of you have already, and ask us your questions live, please call 833-305-1729 and then press *3. You'll be placed into the queue and we'll get to your question as soon as we can. If you're already listening by phone, just dial that *3 to get in the queue to ask a question. So without further ado, we're going to go to Darren, who has called in with a question. Looks as though his question's about QuickBooks. So Darren, go ahead, ask your question, please.
Tracy, I think this might actually be Heidi.
You're right. I am so sorry. Do we have a question from Heidi? I apologize, Heidi.
Oh, hello. Can you hear me okay?
Yes, I can. Go ahead
great.
with your question.
Thank you. My question is with regard to integration with QuickBooks Online. So I am a payroll administrator for several companies, and so I have a couple of different questions with regard to the integration of QuickBooks Online. Are you integrating with QuickBooks Online, first of all, to be able to submit reports and payments through QuickBooks Online? That's kind of the basis of my question, but then also if I submit my report through QuickBooks Online and for some reason it's not received, or it's received in the FML or the family portal, but it's not showing up my payments, then I have to go in and add all of my employees and all of everything that I need to do in order to calculate my payments in there. Am I going to owe two payments in essence?
Thanks so much, Heidi. Great questions. Anne, I'm going to send these over to you.
Thanks, Tracy and Heidi. Good question. I would say for your specific case and to get direct support, I would go ahead and try to redirect you back to QuickBooks to better get clarification for your specific scenario. We do have information on the family.gov site that has some QuickBooks specific resources. However, for your scenario to cover all of your employers, I think the safe bet would be to first double check with the process that QuickBooks has established. As far as the integration specific to QuickBooks, that'll be QuickBooks would be integrating with Family program. The Family system does not have any integrations externally with QuickBooks. So it would be directionally coming from QuickBooks, and that's why I'm going to point you back to QuickBooks on this one. Thanks, Heidi.
And thank you so much. And Heidi, appreciate you calling in with that question. So we're going to take a question from our online queue here. This is coming from Will. And David, I'll send this one over to you. But Will would like to know whether a C Corp with only employees who are also owners, are they required to participate in FAMLI? And we're also seeing a number of questions around S Corps. So maybe you'll cover those as well in your response. Thanks, David.
Absolutely. And Will, that is a great question because as Tracy just pointed out, you are not the only one asking it. So we've got questions about S Corps, we've got questions about C Corps. From a family perspective, we don't look at the structure of the business. So whether you are an S Corp, a C Corp, an LLC, whatever the formal structure of your business is, we don't really look at it. Our question is, are you an employee or an employer? And the definition of an employee is somebody who performs services for another in exchange for benefit, who is free from direction and control in the performance of that duty, and customarily engaged in a trade. So the difference here, let me give you an example, is if you go into an office and you have somebody who works for you and you tell them what they're going to be doing that day, you're an employer, that person is an employee. If you have a leaky pipe in your house and you call a plumber, that plumber is going to come into your house, you're going to show them the leaky pipe, but hopefully you're not going to be standing over their shoulder telling them how to fix it. Maybe you are. I suggest you don't do that. They get a little bit grumpy. That person, that plumber, is free from direction and control, right? They've got a job to do and they know how to do it and they're going to go do it, and that's their business. They run a plumbing company or they act as a plumber. So the question when we're looking at a C Corp or an S Corp, it's not really, do you have an ownership share in that business? It's, are you free from direction and control? You can have an ownership share and still be working for somebody. You still have a boss. And in that case, you're an employee. But if we're talking about more particularly an S Corp, where you have a single member, so you have one person who owns the company. For tax purposes, though, they're going to be drawing a W-2, and the IRS treats them like an employee. We don't. We look at this person and say, you are essentially a sole proprietor because you are free from direction and control. You are your own boss. And so that's going to be the same for that C Corp. We don't necessarily look at ownership. Shares, it's more about the very specific role and how that person is operating within the company. If you have somebody who is free from direction and control, who is setting out the priorities for the company, who is deciding how they want to do their job and what their job is, then they're the employer side and they don't need to participate. If there's somebody who is directing their work, then they're an employee. So that's what we want to look at. It's that very specific relationship and what is that person actually doing on a day-to-day basis for their job.
All right. Thank you so much, David. We're going to go back onto the phones now, and I'm going to be talking with Susan, who is calling us from Estes Park, and I believe Susan has a question about paying by check. Susan, go ahead with your question for Anne, please.
Thank you. I just wondered if we could mail our check. QuickBooks has the form. It says don't mail this form, but it does have the check made out. And also, I'm on your website, and I think your site's down, family.colorado.gov/employers/my-family-employer. It just comes up with a picture of mountains.
All right, both really good points. So let's take care of the check question, and I'll refer that one over to Anne.
Thanks, Tracy. So when you share that, can you mail in a check through QuickBooks, or excuse me, you're a QuickBooks customer and you're looking to mail in a check, as long as we've got Family has you registered in the system and your wage report submitted, you can go ahead, actually from the portal, when you log in, you can download a remittance form to include with your check, as that would be very helpful for us to make sure that your physical check gets applied to your family account ID. And sorry, I got a little distracted with the down portal message, so I apologize if I didn't quite answer your question in completeness, Susan.
Thanks, Anne. And we did just double check on the website. It is up and running from what we can see. So, Susan, I don't know whether or not you may need to refresh a browser or something similar, but I'm not seeing any functionality problems on our side. So next, we're going to take a question here from Paige, and this one will go to David. Is there a minimum age for participation in FAMLI? David?
So not within FAMLI itself. Our program is going to apply for anybody who is working. And there's a related question we get a lot too, which is what about if there's a family relationship? Same thing, it applies to anybody who's working regardless of their age or their family relationship to the business. So if you own a restaurant and your 13-year-old is washing dishes and they're being paid for that, then they would be participating in the family program. Premiums would have to be paid. They would actually be eligible for benefits. So technically, though, the limit is going to be 9 because that's the age you have to be to work in Colorado in some jobs, in shoveling snow or shining shoes. For anybody else, it's got to be 18. We don't allow minors. And yeah, I did just answer a lot more than you asked, so I could make that minor comment. But generally, no, if you are working, you are an employee, you're getting paid, unless you are working for a local government that has opted out. You have to participate in FAMLI in some way, either through the state system, through a private plan, or through self-insurance. No exemptions there.
Thank you so much, David. All right, we're going to go back to a phone question next. It's going to be from Holly in Fort Lupton. David, this one will come back to you as well. Holly, if you would like to go ahead with your question about some employees you have working in Utah.
Thanks for taking my call. So the business is based in Colorado, but we have work sites outside of Colorado. So we've got Utah employees that live and work there, but the Colorado FAMLI money is being taken out of their paychecks because we use a third-party payroll company. So is that how it should be because the company is based out of Colorado, or should they not be paying those since they live and work and pay Utah taxes?
Yeah, Holly, that's a... Oh, I'm sorry, Tracy.
No. Go ahead.
Holly, that's a great question. Tracy and I agree on that, and we were both about to say the exact same thing. Localization of employees, so figuring out where employees actually work in 2023 is a lot harder than it was 10 years ago or 20 years ago. And this can be a little bit complex. What we look at is really specifically what is the employee doing and where are they doing it. There's some flowcharts on our website that I would urge you to take a look at that can walk you through step-by-step determining if we consider somebody to be a Colorado employee or not a Colorado employee. In most cases, if somebody is fully working outside of Utah and they're never coming in, or outside of Colorado and they're never coming into Colorado, and their work is either specifically located in Utah or it doesn't have a specific location, they're fully remote and they could be working from anywhere, those people may not actually be Colorado employees. And so I would suggest you look at that flowchart on our website. It gives you some good information on how do you make that determination on is this somebody who needs to participate, and then have a conversation with your payroll company. It's possible that there is some criteria there that's being triggered that has your payroll company looking at it and saying these are Colorado employees, but it is also possible that is an error, and you may want to get that fixed. So look at that guidance. Again, it depends on where they are, what they're doing, how often they come into Colorado, where their work is being directed from, but all that information is in that great flowchart on our website.
Thank you so much, David. I'm going to take a couple of questions next from Brittany, who wrote into us. She's asking whether or not there's going to be a claims portal for employers and how employers are going to be able to track when their employees are utilizing this benefit. So, Brittany, we do have it on our roadmap to come up with a portal for employers specifically around their employees that are on leave. That's not something that we're ready to roll out yet, but it will be ready by the time employees are starting to utilize our benefits at the beginning of next year. So hang tight and just know that it's on our radar. Next, we're going to be going back onto the phones, and we're going to be talking to Phyllis, who's calling us out of Loveland. And Anne, this question will come over to you. I know that Phyllis wants to talk a little bit about how she would know about payments being filed. Go ahead, Phyllis.
Hi. Yeah, my specific question may be a repeat of the first one about Intuit QuickBooks Online. It states that it's automatically filing our FAMLI. I wonder, is it filing everything? Is it filing individual employee reports or just paying the money that's due? Is it doing any of the above? And how will I know that?
Thanks so much. Go ahead, Anne.
Thanks, Tracy. Thanks for your question, Phyllis. I agree with you. I'm going to have to redirect you back to QuickBooks, Intuit QuickBooks, as they probably have a handful of product lines, and I'd hate to misrepresent and provide the wrong answer. So in this case, I think the right thing to do would be to go ahead and direct you to QuickBooks. That could really answer your specific questions about how your account and product is set up with them.
Thank you, Anne. And we're going to stay on the live questions here. Next, I'm going to be going to Connor, who's calling us in Westminster. And Connor, we appreciate your patience waiting on there to have your question answered. David, if you could take this question for us about self-insured private plans. Go ahead, Connor.
Yes, thank you, and not a problem. So, David, I have two related questions on self-insured private plans. The first, in reviewing the regulations on the website, they state that you need to maintain a separate account. Is this an account on the books, or is this an actual separate lockbox bank account? That's my first question. And my second question is, say you're a company that doesn't anticipate, given the structure of your workforce, a lot of paid family leave benefits being used. Are you still required to contribute the 0.9% into the account quarter over quarter for so long as the plan remains in effect? Or is there a cap on how much you need to maintain in that account? For example, perhaps a multiple of the surety bond?
Yeah, and those are great questions. Oh, I'm doing it again. I'm so excited to answer these questions. Tracy?
Go ahead, sir. You're good.
Okay. I'm sorry. Particularly on a question like this that is detailed and dives into the nitty-gritty of these plans, it does excite me. So at the moment, it does need to be a separate bank account. That is something, Connor, you're not the only one who has raised those questions about, and we're giving it some consideration on if that is something that should be changed sometime this year before the program fully goes live next year. I'm not sure where we are. That's a very early conversation, but we do need to be that. But we are right now requiring that to be in a separate bank account. And the reason for that is because this is the money that is going to be used to pay out benefits pursuant to statute. And so if you're self-insured, you're going to need to be paying those benefits. And we really want to make sure that the money is available and is secure there to pay out those benefits. And having it in that separate bank account, besides just giving us that little bit of knowledge that this has been set aside, it is also going to have some potential ramifications if we get into a situation where perhaps a court or another agency is looking at those particular assets and wondering if they could be seized to pay off other debts. So we do at this point have that out there as a requirement to be in a separate bank account. But again, that is something that we are considering. So sign up for our newsletter, pay attention to our rulemakings, and see if that's something that is going to change. For the second part of that question, in terms of the premiums that you're collecting, if you're going to be fully self-insured, you're actually able to collect a different amount of premiums. You could collect less premiums as long as you're not collecting more. So that's the requirement here. You can't charge your employees more than they would be paying if they were in the state system. But beyond that, you can modify that to make sure that you have that right amount. Now, one of the things that we are going to be looking at for approval of a self-insurance plan is kind of that financial stability. And is there going to be enough money in that fund to cover current and anticipated family benefits being paid out? But if there's an amount lower than that 0.9% that will get you to that point, you can definitely do that. You can pay all of it. You can reduce the premiums that are being paid by your employees as long as you're financially stable and you're not charging more.
Great. Thank you so much, David. And again, thanks, Connor, for that great question. Next, we're going to take a question that came in again through our online system. So this is coming from Kimberly. And she would like to know, how do you amend a return that you haven't paid for yet? She unintentionally included the employers having more than 9 employees, but they don't. So she needs to adjust that amount owed. And how can we help her with that?
Thanks, Tracy. Good question, Kimberly. Since we're still in an editable timeline of Q1, sounds like you'll need to do a couple of things. First, you'll need to log into the portal and update your account. I think it's like the account profile information, and update your head count or your employee total count from 10 plus to the 9 or fewer option. Then if you also misincluded employee wages and need to make an amendment, you can actually go ahead and do that as an edit right now. So you can resubmit your wage report file if you're doing upload with the updated amounts for the employees you've already uploaded, or if you need to quote unquote remove an employee wage, what you'll need to do is resubmit those individual social security numbers, but update their amounts to $0. If otherwise, another option would be, if that's not clear, to go ahead and work through the contact center to make sure that your account level profile changes are updated, and then the calculations are reran on your employees for Q1. Thanks, Tracy.
Thank you, Anne. Question coming in online here from Warren. Warren, you're asking us to confirm the due date for Q1 2023 reports and payments. So that due date is April 30th, which, as we said, is just 3 days away. But for this quarter only, with this being a brand new program, you do have until the end of May to get those reports and payments into us before they are considered to be late. So you still have a little bit of time, but our formal due date is obviously the end of April. Next up, we're going to be going back on the phone. Let me see where we're going to be going to Jessica. I believe, Jessica, you're calling us from Sioux Falls, and this question will be going over to you again, Anne. So, Jessica, whenever you're ready, go ahead and ask your question for me.
Thank you. Good afternoon. So I was able to upload my report for the first quarter, and we put in the amounts that we actually collected for each employee, but the system calculated an amount that's 2 cents over what we actually collected. Is there a way that that 2 cents is going to be adjusted? Or I know when I called previously, there was some rounding issues. So I was curious about how that 2 cents would be corrected.
Great question. And how can you help us with that?
Thanks, Tracy. Jessica, yeah, the 2 cents, just between the combination of payroll withholdings, paycheck over paycheck, and then the final amount coming in at the quarterly level, there's definitely opportunity for slight variation at the end of the quarter of what those amounts will be. From a system perspective, in this moment, there is not any automated adjustments to be put in place to support those pennies or fractions of pennies situation. However, it is something we are actively working on, and we'll be identifying what that, I guess I'll call it like a threshold of automated adjustments will be. So today, please don't sweat about a couple cents here, and feel confident knowing that we're going to have some mitigation in place here in the near future. And when that comes out, we'll have a little more detail of what those thresholds will look like. That covers it. Thanks, Tracy.
Thanks so much, Anne. We're going to be staying with our live callers here, and we're going to have another question for you, David. So get ready, but not too soon. Tony, we're going to be going over to you here in Denver. Looks as though you have a question for us about W-2s. Go ahead, Tony.
Thank you. I just was looking for some clarification. Earlier you referenced, I think it was an S-Corp, with one employee being the actual owner of the company. My question is, if we have a S-Corp with multiple employees, one of which is the owner of the company, and he gets a W-2, is he considered an employee for the purposes of FAMLI?
All right, David, this one's for you. Go ahead, sir.
All right. I didn't hit the unmute button until you said my name again. So, yeah, Tony, a great question. And obviously, this is one of those more complicated wrinkles of the system. But it is actually the same analysis. So, I was talking earlier, as you said, about the S-Corp, where you have one person who works there, they're taking a W-2, but they're the only employee for tax purposes of the S-Corp, and we don't consider them an employee. In this situation, what you're talking about is a business that's going to have that individual, but they do have actual employees working for them. So that business still needs to register for FAMLI. Those other employees are employees, and so their information needs to be in FAMLI. We need wage reports, we need premiums, all that jazz. But for the owner, if they are, again, free from direction and control, they're not considered an employee. So they do have the option to participate in FAMLI if they want to pay the premiums and they want to have that option of collecting benefits if they ever need it. But they're not mandatory to participate because they are not technically an employee. We actually treat that individual as self-employed. So they're self-employed, and then they get treated just like that for family purposes. So they have the ability to opt in and pay benefits, but they don't need to be included in the count of employees or in the wage reports as an employee.
All right. Thank you so much, David. We're also going to stay on the phones again here. It looks as though we have a question from Pam. Oh, it's an online question. I apologize. So Pam is asking us about login.gov. So Pam's logged into login.gov, but doesn't have the option to select the dashboard in order to enter employee and payroll information. Anne, is this something you can help us with?
Thanks. I will give it a try here. Pam and everyone else, we are using login.gov here at the state as a added layer of security as a multi-factor authentication. I'm going to go down an assumption path that, Pam, you went to login.gov to create an account, and going straight from login.gov login.gov as a system won't know that you're trying to set up an account for your Colorado FAMLI account. So what I would suggest is that you should be able to come to the famli.gov site and navigate to the portal, which is currently famlyforce.com. And at that point, go ahead and go through the sign in with login.gov process. At that point, it should recognize you as a system. And then once you've authenticated your login, it should send you over to the My Family portal to get to the dashboard and complete the wage reports and whatnot. If for some reason this block of instructions isn't successful, please give us a call here at the contact center at the 1-866-CO FAMLI line, and we can probably troubleshoot a little bit more individually for you. With that, I'll give it back to you, Tracy.
Thanks so much, Anne, and that's really a good suggestion to reach out to our contact center as well. We do have hundreds more questions here queued up, which obviously we're not going to get to them all in the next 15 minutes, but our contact center agents are certainly ready, willing, and able to help you. So with that being said, I'm going to go on to our phones. I'm going to be talking to Vaughn next. And Vaughn, we're going to have David answer your question for you. It looks like you're having a little bit of difficulty here with trying to make a payment. So Vaughn, why don't you tell us how we can help you?
Hi, can you hear me?
Yes, we hear
Hello?
you.
Oh, awesome. So the first part is that I have a few clients who have 9 or fewer employees, but they would like to pay both parts of the family, the employer and the employee part. So when I go inside the website and I try to pay both parts, it will not let me pay, I don't know, a couple of cents more than 0.45%. I was wondering, is there any way we can get around that?
Hey, David, are you able to take this one, or Anne? I'm open to either of you.
I can jump in here.
Oh, go ahead, Anne.
From a system perspective, that's the perspective I'll be sharing from, is if you go onto the portal, you submitted your wages, and then you go try to navigate through the payment screen. We will, and the balance is showing $100. You can pay $100, or if you select the other radio button, you can pay, I believe, less than. But currently, the system is not set up to take anything more than that. So I think if your calculations, it was $100.05, we won't be able to have you send or submit a payment online for $100.05. You would be capped out at that $100 based on the premiums calculations that happen through the system.
Hey, David, did you want to add anything, or are we good here?
Well, Vaughn, I heard you say at the beginning that that these were employers who had 9 or fewer employees. And if that's the case, the premium is only 0.45% of wages, and that amount can be deducted from employees, or it can be paid entirely by the employer. But if you're trying to pay 0.9%, that would actually be double the premium that was due for those employers. So it's great that those employers want to pay the premium on behalf of the employees, but they only have to pay 0.45%. So it might be that there's a mismatch here between the amount that those employers are expecting to pay and their size as a company. If it's 9 or fewer, the premium is only 0.45%, and that whole amount could be deducted. If it's 10 or more, the premium is 0.9%, and 0.45% may be deducted from employees. So if our system's calculating premiums for a smaller company, it's giving you a number, and that's the amount that should be paid. It might be telling you that you're trying to pay a little bit more than required. And typically, I'm a huge fan of people giving me money. I would welcome any money that you wanted to send me, but in this case, you don't need to pay extra. So go back, tell your clients that you found a way to save them 0.45% on the premiums. And I think that will also fix your tech problem.
Dave, thank you so much. We're going to stay on the phones here, and we're going to go to Keith in Denver. So Keith, this question is going to go over to David for you. But go ahead and ask us your question, Keith. You should be live.
Okay, can you hear me?
Yes, we can.
Okay, good. Okay, so our business, if you can call it that, it's a household business. It involves the owner, quote unquote, would be my partner, Nidra, who is disabled with a stroke. And so our employees are household employees. They are caregivers. And so we pay them by check every week. One is a full-time, one's part-time, but they're here every day. And So one question I have is, so I give them a check, and so I just don't understand how this other payment, which we were given our first quarterly premium of $86.58. I don't understand how we pay that, or how does it get deducted? I mean, I have no idea.
All right, great question, and we can take care of that for you, Keith. So, David, would you like to go ahead?
Yeah, and I'm happy to answer that question, Keith. So what's going on here is that you have some caregivers who are working within your household. They are underneath our law considered your employees. So what you do need to do is register with our portal. So you can find that link online, sign in, register as an employer, and that will also have all of the instructions for reporting the wages that you're paying to those individuals, and the instructions for how to transmit those premiums. So you log in, create an account, tell us what the wages were, and we'll calculate that premium, and then we'll have an online portal for you to pay that as well.
Thank you, David. And you're also able certainly to reach out to our contact center if you're experiencing any difficulties in doing that registration process online. Give us a call. So again, it's 1-866-CO-FAMLI, Monday through Friday, 8 a.m. till 4 p.m., and our agents will certainly be happy to help walk you through that if that's better for you. All right, David, I'm going to be sending another question your way here. This is coming from our online questions. So Susan is asking us whether or not there's a wage cap for subject wages. They're saying that they read in the Employer's Guide to Family, the cap is aligned with FUTA, which is $7,000 per employee. UITR is $20,400 per employee. The family definition of included and excluded wages mirrors the unemployment definition. So I think this is causing Susan a little bit of confusion. If you can help us clarify there, David, please.
Well, I'm a lawyer, so providing clarification isn't really what I do. I go more the other direction. But let me jump in here and see what I can do for Susan. So our wages, in terms of subject and not subject, do parallel FUTA. So that's the unemployment calculation. So we look at, in terms of what is wages, what is not wages, we do look at FUTA for some guidance there. But in terms of the wage cap, we are actually aligned with the Social Security wage cap. So family premiums are paid up to the same amount that you would pay Social Security on. And so that for this year is $160,200. And that's going to be adjusted every year by Social Security, and then we pick it up. We'll try to keep that information out there on our website and available for people to be communicating that as it updates and changes. It's not in our control. It's the Social Security Administration that sets that, but you will be paying family premiums on the first $160,200 for 2023 that any individual earns.
All right. Thank you so much, David. I'm going to take a question here that was sent in to us from Kate. Kate, you're asking for an update on the status of private plan approvals. So hopefully that should be back up on your screen here. So we have multiple private plan carriers that are currently in the process of going through the approvals process with ourselves in the Division of Insurance. We should have some of those out here fairly soon. I'm reluctant to give you an exact date, but just know that we are getting fairly far down in this process. Just be aware that employers must also be aware that this is not an automatic approval. You'll still need to submit that plan to FAMLI. You'll need to go through the approval process with us before you will be confirmed as having a private plan option. So hopefully that helps you there, Kate. All right, we're going to go back onto the phone now. And David, this one will be coming your way. And Kate, Sandy. Sandy, we'll be talking to you here. I believe you've got a question about the filing and how that's going to work for you. So go ahead, you're live, Kate. Not Kate, I'm so sorry, Sandy.
Oh, thank you. So my question might be a little premature, but my question is more about 2024, once everything is in place, how does somebody actually file to get this benefit?
Great question. David, that one's for you.
Yeah, it's never too early to be thinking about that, and we definitely are. We're still in the process of designing that system, and particularly the public-facing portal, but it is going to be an online portal, so somebody will be able to come in. They can set up an account with their information on it, and then let us know that they would like leave. They tell us what the basis for that leave is. We'll give them the appropriate documentation that they need to then supply back to us. Again, if it's a serious health condition, they're going to be able to access that integrated healthcare provider portal. So all of that would be online and automated. They tell us, I have a serious health condition. Here's who my doctor is. We would electronically send the form to the doctor to have them complete in the portal. And that all comes back to be reviewed internally here at the Family Division, where the leave will be approved or denied, or approved as modified. If for some reason we think, you probably don't need 12 weeks of leave to recover from a sprained ankle, although you could be. Don't quote me on that. There are bad cases out there. I have seen them. So it's all going to be online. You'll get a notification of approval or disapproval, and then those benefits will start within 2 weeks of the day that the leave is approved. That process will also notify the employer that an employee has requested and been approved for a certain amount of leave. So the employer will know, hey, the Family Division has looked at the documentation that was supplied, the information from the doctor, or if it's another type of leave, the appropriate documentation there, and this person has been approved for leave for these dates, or if it's intermittent leave, they'll have the guidance there on how to handle that. But it's all going to be online. It's all going to be through a portal. And the goal here, as always, it's still being designed, but we want to make it as user-friendly and as accessible as possible. And that's where we are right now. So stay tuned. Subscribe to our newsletter. We should have that portal up. Well, we will have it up before the end of the year. I don't have a specific date, but we should have that up and available for people to be taking a look at here sometime before the end of the year.
Thanks so much, David. We're going to go to Charles next. I know you've been waiting a while for us here, Charles, and we appreciate that. You're calling us from Highlands Ranch. What's your question today, sir?
Thank you. Part of my question, I think, was answered that I own a business. I'm the employer and the only employee, so I do not believe I have to register or make any payments. Is it correct I don't have to register in any way?
David, over to you.
That is correct, Charles. And, I see some other questions popping up too. I know you were waiting a while, and so I said some things that were relevant to that, but I never did actually answer that question. And so let me answer it now. If you are a business owner, there are no other employees, you're free from direction and control, it's your own business, it's your own thing, you don't have to register. You don't have to do anything. You can walk away right now. But you do have a choice. You can opt in, and you can register, and you can pay premiums. Now, that process isn't open yet. It's going to come up a little bit later in the year. But I urge you to think about it and consider if that is something that would be of a benefit for you. A lot of people out there, whether they're in an S Corp or they're a sole proprietor, they don't have any type of business organization. But if you're your business, what Family can offer for you is some of this wage protection. So if you are in a situation where, because of a serious health condition or because of the serious health condition of a loved one, you're not able to work, instead of shutting down your business, you have this option here to have insurance, an insurance product that is going to supply you with some wage replacement for that period of leave. So it's your choice. You can either walk away, you don't have to do anything, you don't have to register, you don't have to file and opt out, you can just completely ignore us. But if you want to participate, you do have that right to opt in and to pay those premiums and to get that level of protection. And you got to make the choice that's right for you. But again, the answer here is no, you don't have to do anything. You don't have to register.
Great, David. Thank you so much. All right, so I'm going to close us out here with a question we received online from Nate. Nate is asking whether non-birthing parents are allowed to take paid family leave after the birth of a child? And the short answer to that one is yes. And be aware that does include children that may be born later on this year. Be aware that you can take those 12 weeks of paid family and medical leave to bond with that new child up until their first birthday. So if you have an addition to your family coming up here in the next few months, still be aware that you may be eligible for this leave next year. So I want to thank everyone for participating today. We really do appreciate this interactive experience. We'll be emailing out this recording later on this afternoon to everyone who registered with us through email. And again, don't hesitate to reach out to us through our contact center if you have any questions. Thank you so much. Take care and have a good day.